Bismillahirrahmanirrahim. The topic of my today's presentation is impact of air pollution on allergic rhinitis. I have a disclosure to make that this presentation competition has been backed up by Veric Pharmaceuticals. Let me introduce myself. This is Dr. Bisra, and I have been a chronic patient of allergic rhinitis. Every day I wake up in my morning, I make sure that my room or the surroundings that I walk in, they do not have any type of specific allergen that would trigger me and my allergic rhinitis specifically. I used to carry this handkerchief to entertain my unannounced episodes of sneezing and runny nose. Listening to all this, it would seem that it is sorted. But at times, it is very inconvenient for me to carry myself socially and not feel embarrassed about it. And I am very scared that what if any episode of these proximal sneezing attack or running nose, wiping my nose would lead to a really annoying self image of mine or distort a public image of mine. So, this is all what a patient of allergic rhinitis experience, and this is what we as like whole everyone facing allergic rhinitis would have experienced on having an acute episode of it. So the words itself tell the definition of this disease. Allergic rhinitis, itis inflammation of the nasal mucosa that is caused by the allergies that trigger, leading to sneezing, congestion, and runny nose, along with itching in the eyes, throats, and ear. Patient also complain of postnasal discharge and episodes of cough and congestion in the throat. All have been experienced when they are exposed to allergens like pollens, mold, pet, smoke, dust mites, especially the smokes that come from the heavy vehicles or factories. And they all add on to releasing very toxic, noxious gases like ozone, nitrous oxide, sulfur dioxide. Besides, there are natural causes, but mankind, by not being kind, has added majority of the air pollution by its man-made substances. As we all know that Pakistan stands as the in the third world country which is surviving in its development phase. There are a lot of constructions happening, housing schemes, and factories and industries that release smoke. Along with that, for the past few years, there has been an introduction of a new season, smoke season, that is very rampant and persistent. It all led to Pakistan securing the highest rank, specifically the first rank this year among all the countries of the globe for having the hazardous air quality index. And this is quite alarming. What does pollution do to us? It primes our nose, and whenever we meet an allergen, aka antigen, it triggers a cascades of events, reactions that produces Ig antibodies, and Ig binds to the mast cell, thus releasing the histamine granules, leukotrienes, cytokines, which causes vasodilation, itching in the eyes, throat, nose, sneezing, and congestion all around. But what if a patient who is already an existing patient of allergic rhinitis, he experiences such episode of allergen exposure? It really gets worse. I have scientific evidence to support this association. This is the recent meta-analysis that is published, and it shows the association of air pollution to the risk of allergic rhinitis, and it has been quite backed up by the statistics as it is shown that a lot of heavy particulate matters and noxious gases like ozone and sulfur dioxide, nitrous oxide, they have been shown quite significant numerical association with allergic rhinitis in our patients. Now, why are we discussing the air pollution? Why is it a matter of question to us? We being ENT forefrontiers, we have witnessed that there is an exponential increase in the influx of the patient that we see in our clinics. They come up with a complaint of having clogged sinuses, exacerbation of the asthma, pain in the ear, throat, and all these patients would have come up with the use of excessive over the counter medication, including the antibiotics, all over the counter medicines like heavy antibiotics like vancomycin or linezolid just for mere allergic rhinitis. When I say mere allergic rhinitis, it's just on the basis of the pathology, but not on the basis what it does to a person. It fogs the brain, it clogs the sinuses and fogs the brain all together. It leads to the quality of life of the person from 10 by 10 to a 2 or 3 by 10. It affects the whole productivity of the person whenever he or she is exposed to that particular attack of allergic rhinitis. How can we prevent or treat the case? Preferably, wear masks, shut the doors and windows when not necessary, use air purifiers, use saline nasal irrigations, and well prescribed anti-allergics like oral antihistamines, non-sedative or inhaled nasal corticosteroid sprays, nasal decongestion sprays, and as per the IRA guidelines, allergic rhinitis and its impact on the asthma, the maintenance therapy of immunotherapy and leukotriene inhibitors, all they have been introduced and it needs to be implemented as such. And not the use of antibiotics should be or any other thing that is not listed and under the guidelines for use of for the allergic rhinitis. It should not be advocated as such. Last but not the least, grow green, plant more trees, use electric energy drive vehicles that do not add smoke, heavy smokes to worsen the air pollution. My take home message is though we have established that air pollution is like directly linked to increasing the risk of the allergic rhinitis, but air pollution itself, though potent, but it is a modifiable risk factor. And allergic rhinitis, on the other hand, it is not life threatening, but yes, it is life altering and it can be preventable, it is controllable, it is manageable by the use of the right drugs. So, we living in our cities, living in our uh, homes and houses in our regions, we deserve to have a clean, green, and a very smoke free environment. But at the same time, we need to understand that the clean air is not a luxury, it is what our healthy airways require and we need to step forward to maintain it properly. With this message, I would sign out. Thank you so much.